What's up, everyone? This is Dr. Charlie Johnson, physical therapist. Hope you're doing well. Appreciate you checking out my channel. I am here with Anelise. Anelise, you are from originally? Is it Brazil or where are you from originally?
Yeah, I am from Brazil, São Paulo.
Nice, very nice. Never been there, but heard really cool things about it. So either way, you were dealing with, quite a history of some was all over the place, but SI, kind of back, hip stuff, right? Really, nobody was super sure as to what was going on. And so I want to take some time today. I just appreciate you taking some time out of your day to share your sort of like recovery journey. We'll call it a success story, though, because I know you were a bit skeptical in the beginning. And we went back and forth for probably many hours. I remember flipping burgers while I was trying to talk to Anelise about how I thought we could help, etc. And I am just so glad we were able to kind of get you over the hump and sort of truthfully just kind of like get you out of your own way, right? So you're here now, and I appreciate you taking the time to do this because I know your story can inspire other people who are like you. Cool?
Yeah.
All right, so let's do this, right? So like before the program, all right, how long had you been in pain? Give me an idea of like the history there, lengthwise.
About 3 years.
Okay, about 3 years. Yep. And
Yeah.
what were you told was wrong with you? So give me some labels, right? I'm sure you got lots of different diagnostic labels to explain why you hurt. What were some of those reasons?
I think it started with pressure on the SI joint, and then it changed to like Piriformis Syndrome, and the MRIs didn't show anything, but it showed a little bit of this, a little bit. So it was a little bit confusing. Nothing very clear. Yeah, in terms of labels, these were some of the labels. So like pressure on the SI joint and Piriformis Syndrome.
Okay. How about like hip bursitis, labral tears,
Oh,
like any of these
yeah.
things too?
Yeah, so
Okay.
I was also, I went to so many doctors. So some of the other ones talked about hip bursitis, and then I got a bunch of those injections, on the bursa, on the back, on the hip. So
Yeah, I get
yeah,
it.
but nothing about ligaments. It was, yeah.
Okay, so yeah, SI joint problems, Piriformis syndrome, we'll call it, hip bursitis, labral tear, just kind of like all kinds of different stuff, sort of a mixed
Yeah.
bag, right? How many docs did you see, would you estimate? You have any idea?
Oh man. It was a lot. I'm guessing 4, maybe
Okay,
5
okay.
doctors, and then maybe 3 physical therapists.
Mhm. Cool.
Yeah,
Okay. Yeah, so a bunch of people, we'll just say.
yeah.
All
A
right,
lot
got
of money wasted.
yeah. That's all right. Okay, so can you paint, because I want to get to that in a minute, right? But can you paint a picture of what life was like before the program? So maybe things you had trouble doing, and kind of like what it looked like to live, with the pain that you were dealing with.
Yeah, so I started decreasing more and more the amount of walking I was doing. And as a consequence, my social life, certain aspects of it that involved going out with people on a hike or something, that decreased a lot. Limited time sitting or limited time spent standing. So those are some of the things that my pain was kind of leading me to do. And then being very careful with exercises, and trying to figure out which ones would give me pain, which ones would not. So, but the main one was walking. I had to, every time I walk, I'll have a lot of pain. And I live next to the beach, so I couldn't walk on the beach anymore. So it was very sad.
Yeah. Okay. So yeah, you reduce your sitting tolerance, you reduce your standing tolerance, you reduce your walking tolerance, right? Therefore, couldn't really do stuff that you needed to do, maybe trouble with work too, like all this stuff was impacted, just big life
Yeah.
impact. Yep, totally. Okay. And give me an idea, like how long, right? Was it that there was a limitation on the amount of walking, or was it just like afterwards you were just like in a big flare up? Like talk to me about kind of how limited your walking became.
So sometimes I would walk and I would not feel anything. And then after it, I would have a lot of pain.
Okay.
Sometimes if I was walking uphill, then I would have the pain right at that moment.
Mhm.
But it varied a little bit. It was never, and walking fast. If I try to walk a little fast, if I was in a rush, I would also have pain. But it was never the same. Sometimes that would happen again, but sometimes it would change a little bit.
Okay. So yeah, there was like this delayed pain sometimes.
Yeah,
Okay, so you were doing maybe okay while you did something, but then later you would experience pain and then be like, what the heck happened? What did I do? What was different, right? And you went into that kind of like mode, right?
exactly. And it was always hard, like, what did I do that caused this pain? So it was, my mind was always trying to figure that out.
Yeah, you're stuck in a figure it out mode. I get it. All right, so let's talk about these things. So again, maybe you saw 5 different specialists, if you will, maybe 3 PTs, maybe some other people, right? But like, what treatments, right, did you try within that, right? So I know you mentioned you had like multiple shots, right? Like steroid shots, things like that. Can you just kind of go through some of the treatments and some of the techniques or methods, I guess, that were tried and kind of what happened with those?
Yeah, so it started with the shots, and I think I took either 2 or 3.
Mhm.
And then it was a lot of physical therapy.
Yep.
So many, I don't remember how many. And I did, even when I was back here in Brazil for vacation, I did it here too. But I would guess like almost 30 sections or even more than that. And it was
How many
always
sessions did we have? How many
no
times did I meet with you?
one time.
1? All right, cool. Go
And
ahead.
I was
Sorry to
already
interrupt.
good when we met. So technically we never met.
Go ahead. Keep going. I interrupted. Sorry.
No, that's it. No, it was a lot of stretching,
Okay.
so it was a lot of stretching and a lot of exercises specific to certain locations.
Mhm.
But yeah, mostly stretching and some exercises.
Okay. Cool. So what was different about this, right? Because I had lots of people reach out to me and say, Charlie, I already tried PT. You're just a PT. So what are you going to do? Right. And so what was different about this experience? I know that was your question too, even before you came in, right? So can you share a little bit of what was different, maybe big picture? You know what I mean?
So what was different when I started the program with you?
Yeah, and or like what was different about you had tried 1 PT, 2 PTs, 3 PTs. I'm just another PT. So Charlie, what are you going to do different? What was different about this approach and or this experience, if you will?
Okay. I think the first thing was a video I saw on YouTube, and
Mhm.
you said, like, have you been stretching a lot and is stretch not helping? So you have a different approach to everything else I have been receiving,
Mhm.
so that was one thing that called my attention.
Yep.
It's like, hey, this is a little bit different, and the other thing is there is a lot of I'm a professor, so I look at like research, and knowledge a little bit differently. And then I noticed that a lot of times you cite research and some other things. And this usually does not happen like in a doctor appointment or in a PT.
Yeah.
So there's certain aspects, and it seems that you've seen so many people about this, and then when I started the treatment, it was a lot of reading.
Yeah. Yeah.
So it was like an insane amount of reading. I was like, whew, and videos, not reading, but videos, a lot of videos.
Yeah. Yeah.
So yeah, those were just very different than, and I think it was more you helping us to obtain knowledge, so we would be able to do what we had to do instead of getting all the information from you.
Yeah.
But you kind of helped to find the most important parts or details.
Cool.
Did I answer the question?
Yeah, you did a perfect job, right? And so look, at the end of the day, I used to do lots of fixing for people. I was maybe traditional PT when I started, right? I do these stretches and this massage and this and that. But I found that I was good at fixing people in the moment, but it was almost always temporary because people like you didn't know how to fix themselves. And then I realized that you, person in pain, or whoever's watching this, right, are in a really powerful position because you have something that I don't, your pain, right?
Yeah.
And so it's your pain experience. And so I said, what if Anelise had my brain? What if you watching this had my brain as a specialist who only treats people with these problems and has a specialty within this area? Do you think that you'd be more or less confident in solving this? And the obvious answer, well, is probably more, right? And so I said, how could I give that to people? And so you mentioned, hey, I had a different approach. I wasn't just doing what everybody else was doing, but that it was also kind of evidence-based or research-based and scientific, right? Like, how many exercises did you do?
I don't think I got to some of the exercises part. Like I stopped before it. I didn't need it.
Yeah, cool. So people might say, how the heck is that possible? And you highlighted something really cool. You said, Charlie, when I started the program, there was there was a lot of study, right,
Yeah.
involved. And you might say, well, why am I going to sit here and study? Tell me the exercise to do. The difference between you and I is that I have knowledge in this area. You're a smart lady when it comes to what you do, but you just don't know what you don't know as it relates to this. All right. No matter how much Google tells you or YouTube tells you, right? There's a missing piece, right? And so my goal is to say, look, I need you to study this, learn, then I need you to do these things. And then, heck, you can share it with other people, right? Maybe like you are now. And so I really, again, love seeing this come full circle where you're kind of inspiring or teaching other people about the fact there is a different process and that you can, at the end of the day, learn to resolve your own pain. So yes, we start people off by filling in that knowledge gap. How do you fill in that knowledge gap? You have to educate people in a different way. And so through educating yourself in a different way, you realize this isn't all about what I thought it was, exercise and doing all these stretches or whatever. In fact, it doesn't have to be even, I would say, as hard. There could be a less is more approach, but how do we know exactly what to do? Well, we've got to study. We've got to understand what things make our pain better or worse. We've got to understand not only the physical side of things, but also the mental, emotional side of things. And so that was really cool. I think you did a good job of sort of maybe explaining that. So I appreciate that. Okay. Kind of on that same topic, there are many people who I chat with who I know we can help, but they get in their own way because one thing that stops them is like, you know what, Charlie, I've seen so many specialists. I've gone to the Mayo Clinic. I've seen the best person here. They're the doctor for this sports team. I hear all kinds of stuff, right? And it's okay. It doesn't mean I know everything. It just means that people kind of have this hierarchy of like, you're a PT, right? And this person's the best. And I went there. And if they couldn't figure it out, how are you going to go and figure it out? And my answer is, I'm not going to figure it out. I'm going to teach you what I know, and you're going to figure it out, which you did. Okay. I chatted with you one time, and that was after you were already better, pretty much. All right. When you had, I don't know, many, many sessions with other people, right, who are smarter than you, right? And so because, Charlie, I'm not the doctor, how can I possibly help myself? And I think the difference is that we educated you. And would you agree that that was like the big difference compared to other approaches? Is that like
100%? Yeah, and I think PTs, they will try to educate you, but it's different. I think your program works to give us kind of more of a big picture instead of focus like, oh, this muscle and this ligament and blah blah blah, and you give us, and it's not only about the muscles and ligaments, about the mind. Like in my case, it was all about the mind.
Yeah, cool. And so like if somebody was like wondering, hey, I've seen all these people, there's no way that I can figure this out, because if they can't figure it out, there's no way I can. Like, what would you say to somebody like wondering if they can actually heal themselves? What would you say?
If it happened with me, it can happen with you. I think if someone was telling me, I don't think I would have believed it, but it happened with me. And it was like a step of faith, and you were so flexible with me, talking and helping me, because we're skeptical at the beginning, right? We're always skeptical. But yeah, your patience and your material and the evidence that was available, that helped a lot. But like going through the program and be able to be without pain, is just amazing, and it's just following the steps, right? So there's nothing more than that. It's just following the steps that and it's so clear and so direct that it's not hard. You just need time to sit down and do it. So it's 100% possible. And I know each case is different, right? But if your case is like mine, and I forgot to say, I also went to the chiropractor. So that was another thing I did. Yeah, but it's possible.
Neat. Yeah, no, I appreciate you sharing. So I think this curtails into it yet another question, right? One of the things actually, because I went back to some of like our Instagram messages, because I know that's where you found me on YouTube, Instagram, we were going back and forth again. I was flipping burgers as I was sending you messages like, I know we can help this lady, right? And you took a lot of, I don't even want to say convincing, because the goal is not to, you have to come to your own conclusion. We can't force you to do anything, but obviously I know that you reached out to us for help, and I knew we could help you. So I felt with full conviction, I at least had to give you the best chance of, give you the resources and give you the knowledge to make the most informed decision. You made a good decision, so either way, one of the things you said is like, Charlie, kind of, number one, is this like a generic program, right? Or is this like going to be specific to my case? Well, you've gone through the process now. So like, number one, would you say that your case was like really, really special? Just
I
curious.
thought it was, but I don't think it is anymore.
Okay, so you don't think it is anymore. Good. And then like, would you say it's like, you said you go through the steps, but how, if your case is so special, are you going to be able to go through steps and follow a cookie cutter program? What are your
Yeah.
thoughts on that now?
Yeah, I think now I understand it better. I think one of the sentences that convinced me of trying out your program was exactly what you said. A lot of people came to me and they said, my case is so unique and blah, blah, blah. And you said, you might think it is, but maybe it's not. And I was like, oh, maybe I'm one of those and I'm like, come on, the universe is so big, but the overall issues, all in my case, and I'm imagining a lot of people go back to this one root or a couple of other roots.
Yeah, it's good, right? Because that's one thing holding back. Like if somebody, if you were to talk to someone right now, they're like, hey, I'm thinking about doing Charlie's program. My case is special. There's no way he could help this. It's special. What would you say?
I said I thought my case was special too, and long story short, it's not. And
Yeah, yeah, yeah.
I think your experience is what counts, right? A lot of evidence from that. So, like you said,
Yep.
you have a knowledge that we don't have. So you've seen it a lot. So
Yeah.
we don't. We just are ourselves. So just trusting on that idea, figuring out that
Cool.
it's not a scam.
Yeah, yeah. Cool, cool. Well, thank you. And so look, when you came into the program, I actually was somewhat flexible with the terms, right? I said, hey,
Yeah.
I'm willing to extend it a little bit, access, because I think it was like sometime mid-May or something like that where we started, or somewhere around there, but you had like a trip in like a
Yeah.
month, right? And you were
Yeah.
like, dude, like, I don't know if we're going to be able to do this. So like, can I have some extension? Because I don't want that to screw it up. And so we set a goal, at least I did, right? Of getting you able to walk, right, on this trip. And so we had like 4-ish weeks to resolve like 3-ish years of pain, right? How
Yeah.
quickly, when you started the program, did you start to see results? And then were we successful in getting you to go on that trip and feel pretty darn good?
Yeah, so by the end of the first week, it was already getting better, and then second week, it's insane. It's insane to tell you, yeah. But by the end of the second week, I think it was a lot, like 80%. And then it just started getting better, getting better. It doesn't mean that it never came back. Sometimes it pops up, but then like training, you guys, you and the program train us so well, then it just yeah. So I think by the end of the first week it was already going down. By the end of the second, I think third was pretty good. I had only very, very small flares here and there.
Yep.
And the trip, I was able to do amazing things that I never thought I was going to do.
Cool, cool. Okay, so in 4 weeks, well, in 1 week it was definitely better. In 2 weeks, maybe like 80% better. And then in 4 weeks, almost 100, give or take. It pops up here and there, but like pretty darn good. And that's after 3 years of pain and seeing lots of different people.
Yeah.
Cool,
And
cool.
the amount of walking I did on that trip was insane. Like I never in my life, even when I was great for my hip, never walked this much, so, and I haven't had pain one single moment of my trip,
Yep.
so yeah, it was amazing.
That's cool. So it worked. Yeah.
Yeah.
Okay. So you had some other concerns, right? Let me ask you this, right? Many people reach out to us, learn that this is a virtual process. And some people are like, how are you going to do that? You're a physical therapist. And so there's this kind of hardwired belief that like going in person works better. And so what's interesting is that like I chat with lots of people who've tried in-person treatments and they haven't worked, but still they believe that going to see a person in person works better. And so people are very magnetized to this. You've got to be in person if you're going to feel and fix and poke and prod and figure out what's going on and then teach me what I need to do. As we talked about earlier, I met with you one time after you were pretty much almost 100% better. So you actually didn't need any coaching per se, other than the resources and self-study. But what is your belief about that now? Did you have a barrier in the beginning, Anelise, where it was like, oh, this virtual thing, like, I don't know how that can work?
Yeah, that was a big one too, for sure. Because all the experience I had before was people touching me and pulling and whatever. And so, yeah, that was a barrier for sure. And then when you actually see the program is different, because then you have the materials and everything, but as in the beginning, that was for sure. And I think I talked to you about this. But then you also, like we never see each other in person, but when there was a need, I messaged you and you responded. And then when we had a meeting, you were right there. So you're still accessible. And I think that's the part that is important. You know, if there's one thing that is not really working on there, I was not really understanding, I had you right there when I was needed. But I think the knowledge and experience translated all that into your materials actually makes it not needed. It is we that are touching ourselves and, you know, figuring out where, you know, the pain and the position, which is actually better because we know better about our own pain.
Yeah, I think so. That's cool. All right. So, were there any other big fears, right? So like any other big fears that were kind of stopping you, right? I think one was financial, right? You said, oh my gosh, I have seen, and it's common for people to come to me, I have tried so many things. I spent so much money, you know, like if this was guaranteed to work, maybe I'd do it.
Yeah.
Is that holding you back?
It's always for everyone, especially when you find something on the internet, because you just popped up, a video of you just popped up on my social media stuff. So that was for sure a fear. But then talking, you know, to you and seeing also your care and talking, and it was clear that you're, of course, you know, you need money. We all need money, but you were very attentive to my thoughts and concerns and everything. And that made me feel like, hey, this does not seem like a scam, you know, and all the evidence is from all the testimonies and everything that goes back. But, you know, if it would be that would be stopping me from getting better, I decided to take a step of faith. I was praying a lot. I'm like, God, give me wisdom, you know, and I tried everything else. So why would I not try this, you know? Yeah. And it was worth it.
Cool. So where are you now, right? Like one thing you mentioned is really cool and really, which is awesome to hear because it's my goal. Like I'm a teacher at heart. I used to teach at USC. I used to teach here in Central PA, right? And just like naturally, I like educating people. And so my goal is always to give people the tools, the knowledge, the resources, the support, and that transfer of knowledge. Like I want to take a piece of my brain and plug it into you. So then you as the person in pain know what you need to do. God forbid something pops up in this area, or you can use it for other areas too. So would you say like we've been successful in that as far as like where you're at now in the ability to handle anything that pops up in the future? Or do you still feel lost? Like you got to go ask someone for a sheet of exercises? Like where are you at now?
No, 100%. No, this is, I'm completely not lost. And I think I'm applying, you know, I'm being able to transfer that knowledge. I was having some hand pains and I was able to transfer to that. So completely unrelated to the hip, right? So I'm already transfers a lot of those ideas to other pains that I'm feeling. And I was working out and I got hurt. And again, I was doing the same process. I'm like, okay, let me focus on what I've learned. Let me talk to my brain about what is happening. And then like 1 week, it was perfect. It was better. And this was not a pattern that I've seen before. So I've been able to transfer, you know, the knowledge to even other parts of my body. And even explaining to a bunch of people. I've lost count. It's for me, such a big miracle to be without pain after so long. I'm just telling everyone.
Yeah. Cool. Well, we appreciate that. So, all right. So would you recommend, for anybody who's on the fence, would you recommend the program, or would you recommend they wait a little bit longer and think about it? And what would you say?
Of course, I would say for them to just go for it, right? Cool. If by the end of the first week it was already better, why wouldn't you risk it? You know, it's a worth risk. It's a worth risk. Yeah. And I'm happy to talk. Just get your examples, people. Like we're not getting paid here. We're just really rejoicing that we're feeling better.
Well, I appreciate that. Yeah, because I chatted with somebody actually just the other day, and they said, "Hey, I need a few weeks to think about it." And I wasn't trying to be smart, but one thing I said is, "Well, you can be better by then." And I don't know if they liked it or not, but it's true.
It's true that it is true. And like when I was starting to feel better, I haven't chatted with you, nothing. It was just reading the material and learning. So
Cool.
Yeah.
Well, you've done a really good job, and I know you're able and capable and enjoy learning too. So that's kind of a prerequisite, right? It's like, hey, if you're looking for a fast fix, this was a fast fix, right?
This was in my case, it was pretty fast.
Right? But in the sense of like a Band-Aid, a short-term Band-Aid, we're going to massage this area and your pain's going to go. And then, I don't know, hopefully it stays away, right? This is like, look, that might work, right? You could go get a quick fix somewhere else, right? In the terms of like you relying upon someone else, right? But at the end of the day, like if you don't change your knowledge base and you don't understand what you need to do long term, then that's really going to be limited. Okay. And so there's lots of stuff that we can do in person to make people feel better. But if you think not only short term as far as getting out of pain, but then also long term, like you said, if other things creep up and you're willing to put in some time and effort, I mean, gosh, the time and effort people spending driving, on these busy highways, sitting in the office, on social media, that's another thing. Like, you could just save so much time just having somebody synthesize, right, everything. And that's what we've done inside the program.
Someone that knows what they're doing, synthesize those things.
It's a good point. Thank you.
Yeah, because there's a lot of people synthesizing a lot of things online.
Yeah. And this is why I chose to specialize, right? So you see lots of, maybe PTs who treat shoulder pain and neck pain and knee pain and foot pain. That's fine, right? You can still use the principles. But the idea for me was to say, hey, look, I'm a PT. I have my orthopedic board specialty, and people with these problems, back, hip, butt, leg, sciatica type stuff, they're often mysteries, right? Not to me per se, but to lots of other people. And so I really wanted to niche down, study all these different approaches on both the body side and the psychology side, and then marry it all together to give you the best chance of solving this with full conviction, like the best chance. That's my goal, is to create a program that is like, if you go through this program, you do not see what you want to see, something happened.
Yeah. And I think, and that's the other cool thing, is not only like the psychological, mental part, that is the other part too. So the program puts everything together, the needed part together.
Yep. Could you have, without the synthesization, if you will, of the program, could you have just DIY'd this, like going on YouTube, like trying to find all this stuff? That's another common thing, is people are like, hey, I'm just going to keep looking and trying to like figure this out. Like, what's your perspective there?
I don't think so, because I think even the scaffolding, from the first to the second to the third lesson, like you need the whole skeleton to be able to understand the big picture. And I think watching a video here, watching a video there, does not give you the logical steps and the scaffolding to understand what you have to do and what you have to stop doing also. So I think the videos are great for people that are just trying to know you and know your clients. But in terms of the treatment itself, you just miss too much information.
Yeah. So it's like you have these pieces of the puzzle, but it's like, what's the structure and or the process through which you put them together? Do you put the perimeter going first and then you fill them in here, or how do you do it? And so, that's what I noticed too, as a now past professor. But you can have all the information in the world, but if you don't have a structure or process through which you can absorb it, right, and how to apply it, then you can learn things out of order. You can be doing stuff that you don't know if it's right for you or wrong for you, or how often you should do it, or when you should do it, or when to move to the next phase, right? And so we really try to, in the 4 phases that we outline for people, we really try to kind of bring things full circle, starting with the basics, giving you knowledge, right? So you can fill in these gaps and understand what you need to do and have some big aha moments, boom, shift your perspective. Then you start filling in the gaps. And you're right. It's like I don't know. It's like a cake. It's layered, if you will. Without the foundation.
Lesson.
Yeah. Without the foundation.
Beginning, middle, and end, and helps you to go through the whole thing.
Totally. Yeah, and you need a strong foundation to make that happen. So that's the idea behind the program. Cool. Well, hey, look, it's been a pleasure working with you. I'm just so grateful that we had the chance to help you inside Glute Relief Accelerator program. So that has been just awesome to see your transformation. And this is why I'm so passionate about what I do, because it is just the coolest thing, like to have something that helps people often very quickly, especially when they've tried lots of other things and when they don't believe it to begin with, right? Yeah. So you get some cool transformations, right? Anything else that you want to share? I appreciate you taking the time. Anything else you want to share for anybody who's on the fence or just, maybe not so sure about taking the next steps?
Look at the evidence that is out there, and then if you're still on the fence, then just talk with him. He was able to help me understand and put some of my fears aside and understand, because I think we're also hurt and tired of being in pain, that we sometimes look at things a little bit different, and having this other perspective was helpful. So I appreciate, Charlie, your patience and your flexibility too. I had that trip and you were helping like, hey, we can do this, we can give you this. And
Yep.
yeah, so thank you.
Cool.
And I'm very thankful for this program.
Yep.
And without paying, yay.
Anelise, like, thank you again so much. I appreciate you taking the time, and we'll be in touch. And you have me as a resource for as long as you need me inside of the program. Okay.
Sounds good. Thank you.
No problem. Thank you.